Thank you. You can hear me?
Thank you.
Thank you, Dr. Frey-Gary. Can you hear me?
Yeah, I can hear you. How are you?
I'm good. I'm good. Thank you so much for the fruitful presentation. And we just here having a very, very thorough discussion about the nursing specialties based on community-based and community needs, and the challenges that we face here to have new specialties. Do you want us to like to open the questions if someone have a question for you?
Your voice is not very clear, Dr. Zainab.
Okay, we were just thanking Dr. Frey-Gary for the presentation.
Maybe, you know what, you can lower your microphone. Maybe it works better. Lower the microphone. Lower the, yeah.
Samira, can you hear me? Can you hear me?
Yes, now it's better. Yes, go on. It's better now, much better.
Okay, we were just thanking Dr. Frey-Gary for the presentation.
Yeah. Thank you for the, yeah.
You're more than welcome. It's a pleasure.
Thank you. Thank you. Okay, we here all thank you for the presentation and looking forward collaboration between us, our two faculties. Thank you so much. Thank you. Okay.
Thank you, Dr. Zain.
We want to extend our congratulations to you and to Dr. Warda Youssef to this beautiful and it looks like very successful conference. And we wish you luck, and we will see you tomorrow with 2 more presenters from the School of Nursing.
Thank you. Thank you so much. Bye.
Okay. Okay.
Thank you.
Bye.
Thank you,
Bye.
Dr. Samab. It's good to see you. Send me an email.
Thank you, Dr. Frey-Gary. Thank you.
Okay. Okay, now we will introduce the next research paper under the title of Feeding Pattern Among Infants with Cleft Lip and or Cleft Palate, presented by Nadia Qasim Al-Aswad, Clinical Instructor of Pediatric Nursing, Faculty of Nursing, Cairo University. Please, Doctor. Not more than 10 minutes, please, Dr. Nadia.
5 minutes.
Bismillahirrahmanirrahim. Feeding patterns among infants with cleft lip and or palate, supervised by Dr. Murad Darwish, Dr. Mamdouh Abul Hassan, Dr. Hanan Rashad. Introduction. Orofacial clefting is one of the most common birth defects causing physical and cosmetic impairment. This defect is a serious crisis in the life of the family affected. Not only is the desire for healthy infant unfulfilled, but the family must reframe their expectation for the infant's needs. There are multiple feeding difficulties associated with cleft lip and or palate, and appropriate feeding patterns should be used with particular clefts. Different feeding patterns are appropriate for different types of clefts, including cleft lip, cleft palate, or both. Feeding patterns found to be useful for cleft lips and or palates includes manual nipple stimulation and movement, nipple modifications, palatine prosthesis, and other appliances. Different patterns of feeding that can be provided for infants with cleft lip and or palate to gain weight are breastfeeding, bottle feeding, syringe feeding, and gavage feeding. Aim of this study is to investigate. The aim of this study was to investigate feeding patterns among infants with cleft lip and or palate. Subject and methods. Research design, descriptive exploratory design was conducted in this study. Research question: what are feeding patterns among infants with cleft lip and or palate? Sample: a convenient sample of 60 mothers of infants with cleft lip and or palate from outpatient general surgical clinic. Inclusion criteria: both sexes, from unrepaired cleft lip and or cleft palate infants. Setting: care specialized in the University of Pediatrics. Tools: first tool was about structured interview questionnaire. Second tool was about observation checklist according to feeding patterns used by the infants. Results: percentage distribution of mother characteristics. The mean age of mothers was between 28 plus or minus 5.5. The mother's education levels was 38.3 of mothers in secondary level. Residence of mothers, 60 of mothers was from rural areas, while 40% from urban areas. Concentrated detected in this study between 41.7%. Distribution of infants characteristics. The mean age of infants was 4.7 minus or plus 2.9. Gender, regarding gender of the infants, 51.7 for females and 48.3 for males. Percentage distribution of infants' weight. The minority of infants in the study at birth was less than 2,500 grams. Was by percentage of 11.7, while in the time of the data collection, the minority was below normal by percentage of 18.3. Distribution of infants diagnosis: 56.7% for cleft lip and cleft palate, while 30% with isolated cleft lip, and at least 13.3% for isolated cleft palate. Distribution of feeding patterns among infants as general: 55% for bottle feeding, followed by 30% for bottle feeding. For breastfeeding, 55% for bottle feeding, followed by 30% for breastfeeding. Percentage distribution of feeding patterns in relation to cleft type. In isolated cleft lips, the most common used feeding pattern was breastfeeding by 83.3%, while in cleft lip and cleft palate, the most common feeding pattern used was bottle feeding by 73.6%. And at least the most common used feeding pattern for cleft palate is bottle feeding by 75%. Distribution of relation between mother's practice and their age and education and infant's age. There were a statistically significant relation between the mother's practice and the infant's age. Conclusion: Infants with cleft lip and cleft palate, most common used feeding patterns, most common used pattern among them is bottle feeding. Regarding problems faced by infants during breastfeeding, where inability of the infant to suck followed by inability of sucking associated with choking, coughing, and prolonged feeding time. Recommendation. Based on the findings of the present study, the following recommendation were: education program about management of cleft lip and or palate from mothers having infant with cleft lip and or palate. Early detection of cleft cases prenatally must be encouraged, and referral to a specialist to start management concerning appropriate feeding pattern suitable for the infant's defect. Raising awareness of mothers about early detection of congenital anomalies prenatally to be prepared for dealing with the problems faced by their infants and to avoid period of confusion and shock. Thank you.
Thank you for Nadia. The next presentation,
The last one.
and the last one, will be presented by Manal Ibrahim, Clinical Instructor of Pediatric Nursing, Faculty of Nursing, Cairo University. The title of the presentation: Design a protocol of care about necrotizing enterocolitis in premature neonate for nurses working in neonatal intensive care unit.
Assalamu alaikum. Designing a protocol of care about necrotizing enterocolitis in premature neonates for nurses working in neonatal intensive care units. Supervisor, Assistant Prof. Dr. Suhair Abdelhamid Dabash, Assistant Prof. Dr. Hanan Muhammad Rashad. Necrotizing enterocolitis is an inflammatory disease of the bowel. It is a devastating GI disease that is associated with severe sepsis, intestinal perforation, and significant morbidity and mortality. The incidence of NEC varies between 1 to 2 per alpha live births. It represents 1 to 5% of all NICU admissions. The overall mortality rate for infant with NEC is 25%, with the rate of mortality for more premature babies approaching 66%. Early identification of developing NEC in premature infants is essential to reduce the devastating effects of the disease. Nurses are often the first one to respond to acute changes in clinical status and physical assessment, initiating the series of events to diagnose and treat NEC. The aim of the study was to assess nurses' knowledge about NEC in preterm infant in NICU and to design a protocol of care. It was a descriptive exploratory design to conduct this study, Sample: a convenient sample of all nurses, 66 nurses who working in NICU at Cairo University hospitals were recruited for this study. The study was conducted at the neonatal intensive care units at Cairo University hospitals. A structured scheduled questionnaire sheet was developed. It includes 2 parts. The first part about socio-demographic characteristics of the nurses. The second part about knowledge questionnaire sheet about NEC. The research question was: what is the nurse's knowledge about NEC? Results. According to the socio-demographic characteristics, the mean age was 26.6 plus minus 7.1. The educational levels, the majority of nurses, or the highest percent of nurses were secondary school. Their percent were 57.6%. Regarding to nurse gender, it was found that the majority of them were females by the percentage 89.4%. Regarding to nurses' experience in pediatric in general, the highest percentage were more than 7 years. This percentage, the percentage was 92.4%. Regarding to nurses' experience in NICU, it was found that the majority of them 45.4 were more than 7 years experience in NICU. Percentage distribution of nurses' level of knowledge about NEC, it was found that the vast majority of them had unsatisfactory knowledge about necrotizing enterocolitis by the percentage 97%. Regarding to the relationship between nurses' knowledge or nurses' characteristics and the level of knowledge, it was found that there is a significant relationship between nurses' knowledge and their educational level. Conclusion: the majority of neonatal nurses had unsatisfactory knowledge about NEC among preterm neonates, and based on this finding, the investigator was developed a protocol of care about necrotizing enterocolitis. Recommendations: applying the designed protocol about necrotizing enterocolitis in NICU, providing continuous health educational program about NEC and all common neonatal health diseases must be studied in the curriculum of nursing school. Thank you.
Thank you for Manal. Any question? No? Okay, that is the end of this. Dr. Manal, Dr. Warda, she has a question. Any other question? That is the end of this day. Thank you for your attendance.